So next question is what is the full form of the CRISPR? Well, it stands for the clustered regular interspaced short palindromic repeats. So the answer is A. Now remember that what is it is a genome editing. Remember, it is a genome editing tool that has transformed the field of molecular biology. So it was discovered as part of bacterial immune system where it acts as a defense mechanism. It has a defense mechanism against the viruses. So it is a natural defense mechanism that is found in bacteria and that helps them remember and defend against the viruses. So what does it consist of? It consists of short repetitive DNA sequences interspaced with unique sequences that are known as a spacer. So these spacers, remember these spacers, they are derived from the DNA fragments of the bacteriophages. So when a virus, suppose a virus attack, the bacteria capture a piece of the viral DNA. So this piece, it is inserted into bacterium own DNA in this CRISPR region, creating a memory of the virus. So this region, it is transcribed into long RNA molecule. That this RNA is cut into smaller pieces, that is known as cRNA. So if the same virus attack again, this cRNA guides a protein that is known as CAS to the viral DNA. So this CAS protein will cut and destroy the viral DNA and hence stopping the infection. So the answer is A. CRISPR stands for clustered regular interspaced short palindromic repeats. Coming to the next question, the Salmon patch, it is seen in vascular defects. Now first of all, you should know what is a Salmon defect. What is Salmon patch? Salmon patch, it is their common birthmark. So this region you can see is the Salmon patch. So how they appear? They will appear as a flat, either pink, red patch on the back of neck, forehead, eyelids, or between the eyebrows. So remember, these Salmon patches, they are caused by vascular defects. So specifically, they result from the capillary manifestation where small blood vessels, they are more visible under the skin. Commonly seen on the nape of neck, forehead, eyes, etc. And most of them, they fade. Remember, they fade away with the time. So remember, the Salmon patches, they are benign and they don't require any treatment. So they are not associated with any systemic disease and do not lead to any complications. So Salmon patch, they are benign vascular birthmark resulting from the capillary malformation that are commonly seen in the newborns. So for the question part, the Salmon patch pigmentation, it is seen as a vascular defect. So answer is that. Now coming to the next question, the type of inheritance that is observed in hypohidrotic ectodermal dysplasia is, well, we know hypohidrotic ectodermal dysplasia, it is a genetic disorder that affects the development of skin, hair, nails, teeth and sweat glands. So it commonly affects the hairs, the skin, the hairs, the nails, the teeth and the sweat glands. The most common form of hereditary ectodermal dysplasia, it's the X-linked recessive type. Although the autosomal forms they may be seen, the most common form is the X-linked recessive type. That will be your answer. So it will affect the development of skin. So it will affect the skin, hair, nail, teeth and the salivary glands. So gene that is responsible for most common form of hereditary ectodermal dysplasia, it's the EDA gene that is located on the X chromosome. So it will cause hypohidrosis, that is reduced ability to sweat, and can lead to overheating, hypotrichosis, hypodontia, etc. Here you can see is the absence of the hairs, absence of teeth, frontal bossing, hypodontia means missing teeth, hypotrichosis means sparse hair, hypohidrosis means reduced ability to sweat. So these are its key features. Coming to the next question, non-parametric test that is equivalent to ANOVA, it's the Kruskal-Wallis test. So Kruskal-Wallis test, remember it is a non-parametric test that is equivalent to the parametric analysis that is equal to parametric ANOVA. So ANOVA, we know it's a parametric test that is used to compare mean across the multiple groups, whereas Kruskal-Wallis, it is a non-parametric test used for the same purpose. ANOVA is appropriate for interval or ratio data, whereas Kruskal-Wallis is appropriate for the ordinary or the interval data. So remember that the parametric tests that are equivalent to the non-parametric equivalents, for the paired t-test that is equivalent to Wilcoxon rank sign test. Unpaired t-test is equivalent to a non-parametric Mann-Whitney view test, and one-way analysis of variance, that is ANOVA, it is the parametric test is equivalent to non-parametric equivalent, that is Kruskal-Wallis test. So the answer is A here. Coming to the next question, the paranasal senses can be viewed best by, the answer is water stream. Well, water view, it's the best projection for visualizing the paranasal senses. So you can see the frontal sinus. These one are the frontal sinus. This one is the ethmoid sinus, you can see. This one is the maxillary sinus. So the best view for paranasal, visualizing the paranasal senses, they are the water view. So this A radiographic projection is obtained by placing the patient head in position where chin is elevated and allowing the X-ray beam to pass horizontally through the skull. So that helps to visualize the maxillary sciences, frontal sciences, ethmoid sciences. So the answer would be Waters way. In which type of suture material is microbial transmission and the wicking effect evident? The answer is the silk suture. We know silk suture, it is a braided natural material that is commonly used in the surgical procedure. It has certain properties that make it more prone to microbial transmission, and the wicking effect is more common as compared to the other suture material. The silk suture is typically braided, providing spacing between the strands where bacteria can hide, multiply, that leads to multiple microbial transmission. Apart from that, silk has wicking effect, so it carries potentially carrying the microorganism deep into the tissues and hence increasing the risk of infection. So your answer here would be should be avoided in contaminated or dirty wounds where the infection risk is higher. So answer is D. Coming to the next question, adult patient with osteomyelitis of knee joints was treated 2 years back. Now want to go for extraction of asymptomatic third molar. What is the antibiotic coverage pre-medication given? So answer is no antibiotic coverage is given. The pre-medication with antibiotics is not typically recommended for extraction of asymptomatic third molars in the adult if they have history of osteomyelitis of the knee joint that was treated 2 years prior and it is currently asymptomatic. Asymptomatic third molars, they are extracted for preventing or prophylactic reasons or due to the complications like the infection, crowding, and antibiotic pre-medication. It is not necessary. According to the guidelines by American Association of Oral and Maxillofacial Surgeons and ADA specification, antibiotics, they are not recommended for the third molar extraction in a healthy adult patient without underlying medical condition or risk factor for infection. So remember the overuse of antibiotics, they can lead to antibiotic resistance and other adverse effects. So the answer here would be D. Henderson-Patterson bodies, they are also known as, the answer is molluscum contagiosum. So these are this one is the Henderson-Patterson bodies. So these bodies, remember, they are round cytoplasmic inclusion found in the infected cells, and these are regarded as cellular response to presence of the virus. So these bodies, they are actually after the name of Henderson and Patterson, and they are the characteristic cytoplasmic inclusion seen in the molluscum contagiosum, viral skin infection.